Welcome to Series 5, Episode 4 of the Fishing Daily Podcast. And today I'm joined by Deb Johnstone from the Fisherman's Mission. And Deb is the Cancer Community Programme Manager. And we'll be discussing something which has huge relevance for a lot of people these days. And there's very few people whose lives hasn't been affected by it. And we're going to talk about how fishermen must get involved in looking after their health better. So thank you for joining us, Deb.
Thanks for inviting me.
Deb,
Yeah.
one of the main problems that is recognised as a barrier in the path to early diagnosis of cancer is economic equality, which goes hand in hand with health equalities. Can you explain to us what that means and what are the health inequalities that are facing the fishing industry and people who's working in it?
Yeah, I could do. What we found in the northeast, there is a 2-year lower life expectancy compared to the rest of the UK. So people living in the northeast are more likely to have a shorter lifespan, and they spend a lot of proportion of their lives in poor health, as well as dying. They're more likely to die prematurely from preventable diseases. We found that the risk factors that lead to this health decline includes smoking, they have a poor diet, lack of physical activity, and harmful alcohol use. So if we're looking at health inequalities, what we've found is that the programme has identified that the fishermen face barriers and challenges when accessing cancer screening and or treatment. The fishermen have told us that due to the nature of the work environment, they find it difficult to attend health appointments or arrange health appointments. I've spoke to quite a lot of fishermen since I've started in this post and asked about, when they make a health appointment or they have to attend. And they say that they find the problem because they don't know, they've stated that they don't know where they'll be the next day. So they said that the first barrier is actually arranging an appointment. So fishermen, as well as the barriers that we found is actually getting them through the door to a health appointment is the first step. Um, After that, what we found is that fishermen, they're a very proud, hardworking bunch of men that put bringing in an income and for their family first, way before their own health. When they're out at sea, they've got the opportunity to be out at sea. They will be there. So making a health appointment or attending a health appointment is not on their priority list. I've had lots of conversations with the fishermen regarding health and what is their health like, what prevents them from concentrating, looking at their own health. And they said it's down to their working conditions. They don't think about their own health. They don't think about their poor diet, the fitness levels, even down to looking at the long working hours. When I'm talking about, how are you sleeping? How are you looking after yourself? That's something that's not even on their radar. I've had discussions with the fishermen around attending their health checks, getting a health MOT. And yes, this programme is focusing on increasing cancer awareness and the uptake of early cancer screening. We're looking at the overall health, especially when you're looking at prevention. They can make some lifestyle changes in their health and well-being. So this programme is focusing on increasing cancer awareness and increasing an early uptake in cancer screening. But we're looking at the fishermen's overall health, having discussions with them about what can prevent cancer. And there could be measures that they could take to reduce the risk, which is improving their diet, improving their fitness levels, looking at their alcohol intake, looking at smoking. What we're not going to say to the fishermen, because we would probably get a big no and they would close down, their barriers will come down, is we're not going to tell them this is what you must eat, this is what you must smoke or not smoke. This is the alcohol levels you must drink, because as soon as we give that information to the men, they will just shut down, they'll just walk away. But what we're going to do is give as much information as possible, give them the education for they can decide themselves, how can they reduce the risk of cancer. We want to give them that information so they can decide what lifestyle choices they need to make to reduce the risk of cancer. We've also found that the barriers to health is that the men don't want to take the time off work because they can't afford it. With them being self-employed, they're not sure about what benefits they're entitled to. One fisherman says, well, if I go to a health appointment and find out I'm not well, who's going to pay me rent? And he's right. That's what the worries that they do have. Active fishermen have reported to us around some of the myths and stigmas when we're having conversations with the fishermen around early uptake of cancer screening. One fisherman said to us, so you're asking me to get cancer screening to be told I'm dying? And I was really surprised at that, because I thought, well, actually, no, what we're looking at is get cancer screening for early treatment and better treatment outcomes. But the belief is, not for all, but the belief for some is a diagnosis of cancer leads to death. They do not see, some don't see that there's actually good treatment out there. We want to spread that message around the cancer treatment that is available. So what we found is one barrier is some of the myths, the stigmas that are attached to cancer screening and cancer diagnosis. That is something that is generational. It goes back to maybe the 60s, the 70s. That fishermen think is cancer treatment is like it was in 1960 or 1970. It's progressed so far along from there that there is other treatment options that fishermen are not aware of. Having access to these treatment options could lead to better cancer outcomes. It may not change the final outcome, but that's what we hope to. Early cancer screening can give the fishermen better treatment options. It can give them a better treatment outcome, an improved cancer experience. It could give them extra time, as well as being treated and being in remission. It'll give them the opportunity to access aftercare services, to get the right social and welfare support. So what we found is, which is a big barrier, is the myths and stigmas around cancer, and a diagnosis, as well as having cancer conversations. We found with the fishermen, they don't want to talk. Some don't want to talk about it. It is the big C. I don't want to talk. I don't want to know. So that comes back into the neglect also. So the lack of knowledge is a huge barrier. We're saying it's different now, and that's what we want to spread, is that this is where cancer treatment is now. We want to relate to the men the importance of early cancer screening, because there will be improved, better cancer outcomes.
I've had a personal experience with friends and family over the past few years, and anybody who's passed away from cancer, they'll all tell you beforehand it was because they didn't get it in time. They
Yeah.
weren't looking for it. Um, they weren't being screened for it. And then when they finally did go to the doctor, it was too late. And I
Yeah.
think that's the message is, if you think of a problem, get there early and see the doctor. You stand a far better chance if you do that.
Yeah, and what a fisherman said to me, it's like the fear of knowing. I don't want to know what's wrong with me. So he had said that if I don't know, then it's not going to harm us, and I'm not going to worry about it. Yeah, and I was really surprised at that. But I've had similar experience myself with a family member of finding out when it was at stage 4 and it was too late. What, looking back now, reflecting now, is the outcome may have been the same. Well, it would have been the same, the outcome. It wasn't treatable. However, we would have more time. We could have had treatment where we could have more time making more memories. So we're not giving fishermen any false promises, but early diagnosis, early treatment will, could lead to a better outcome. But the medicine is the fear of knowing what's wrong. And one fisherman says, well, I've never put my health first. Well, I never have. That's what he said to me, is I never have. And I said, well, why is that? And he said, well, it's learned behaviour. I just get on with it, just like my dad did, just like my granddad did, and they were both fishermen. So it's something that it's just went along with generations. Is why do we need to put our health first? We need to be out to earn, to bring home the money, and that neglect to put themselves last. And this is from conversations, from being in this post, I have heard from the men at North Shields Fish Quay. This is what I've heard from the men. It's like, well, it's just not what we do. We don't look at our own health because we need to be out at work. Really proud, hard-working population of working men.
I know my aspect of it is your health is your biggest asset, and your health is your biggest asset to your family.
Yeah,
You know,
I agree. And getting that message across, if you don't look after your health, you may not be out at sea and bringing in an income. But when for years, for generations and generations, it's instilled is that you get up and you go out to sea, because if the sea's good, you're out there and you're earning, and you're bringing money home. And it was that it's not until it gets to the point that, they may have found a lump or they may be in pain, that it could be months that they're like that. And they then go, right, okay, I have to look at my health. It seems to be, to me, the last on their list.
what's the most common cancers that's that has a survey been done in the fishing industry to diagnose which is the most common, and how could we look at changing that?
There's lots, as many cancers, but if we're looking at within the fishing community, I've linked that to the risk factors. So higher prevalence if you're a smoker and you've got poor smoker and alcohol use. So when I'm not saying it's most likely, but there is, it's been identified, lung cancer, prostate, kidney, bowel cancer, testicular. Although we are now having conversations with fishermen around other types of cancer. I'll let you know, I had a conversation not so long ago about breast cancer in men. Got a phone call from one of the fishermen, and he said, Deb, can I ask you a question? I was like, yeah, certainly. He said, it might be a silly question. I was like, go for it. You go for it. He said, can men get breast cancer? And I was like, yeah, they certainly can. And he was like, right, okay. I said, what's going on? I had a conversation with him. I said, why don't you come along? Pop in, because we are based at North Shields Fish Quay. We are right next to the gut of the fish quay. I says, come and pop along. Now, since that conversation, and that's only several weeks ago, more men are talking about breast cancer in men. And that's amazing, like that shift. So, yeah, going back on your a question around if there's any themes, trends, we don't have that evidence. We're a brand new programme. It's the first of its kind with the maritime sector. But from the risk factors, we found that kidney, bowel, prostate, testicular are those highest. Lung cancer are those highest, but it's linked to, may be linked to lifestyle.
Fishing is definitely a tough lifestyle. It takes a lot out of the body, and another thing which people doesn't sort of really think about either is that there's a lot of chemicals dumped in the sea. There's a lot of, stuff lying out there that we're totally unaware of that could be having an effect on your health as well. And it's just one of those things where people just have to be very aware of their own body and how their own body functions, and learn about what could be wrong, and notice when something could be wrong. And the Cancer Aware program, can you tell us about it?
So the Cancer Aware program came following our successful CFIT initiative. So we had a CFIT event up in Amble, in which two Macmillan ladies went along to be part of the CFIT event, and they met with fishermen and had conversations around cancer screening. What did it look like? What did it feel like for the fishing community? They found that what I have found is that the fishermen don't either think about it or don't want to think about it, or put it on the back burner, put it at the bottom of their priority list. So Macmillan Cancer Support approached the Fishermen's Mission to work in partnership. And this was due to the Fishermen Mission having 140 years of experience of working with the fishing community and being a visible, trusted presence on the fish quay. So from the UK ports, the Fishermen's Mission staff are a visible presence. So they approached the Fishermen's Mission, Macmillan Cancer Support, and the Fishermen's Mission embraced this because they see that need, that importance, and they wanted to be part of this. So the programme was agreed for 3-year funding was put in place, and it was decided to focus on North Shields as a test site. So it's no Tyneside, but we'll break it right down to North Shields and making that a test site and take some learning from the site and move it across the rest of the North Tyneside. What we hope is wider is that we take even further learning across the UK. It's early days. We are brand new into this programme, but that would be my vision and my hope, that we do share this learning across our other UK ports. So we have myself as the Cancer Community Programme Manager. We have recently employed a Cancer Community Engagement Officer, and we've got joining us in a couple of weeks a Cancer Community Volunteer Lead, and we are all based at the North Shields Fish Quay. So that's how we started. That was our background. But for me, is I wanted to find out, when I come in posters, like, is this what the men want to call it? We've got one lady who is a fisherman, well, she works on the quayside, so we haven't engaged with her as much, but we hope to in the future. So we asked them what they wanted, because Cancer Community Programme is a bit of a mouthful, and these are not my words, these are the fishermen's words. So I met with them. We got in a room together, we sat down and we talked about the aims and objectives of the programme. What is our hope? What's our vision? What's the fishing community's hopes and vision? And that's how C Aware came about. So it's the letter C for Cancer Aware, but C as in C. The men have designed the logo with myself, our promotional material. We want this programme for them to feel it's theirs, it's not ours. It's their programme. It is for them. So we'll be working with active and former fishermen, and be working with their families also.
And how can fishermen or fisherwomen get involved with the programme?
So what we've got is our new person starting, our Cancer Community Volunteer Lead, is looking at recruiting the fishing community be it an active fisherman, a retired former fisherman, a family members, a friend, anybody who's got that connection with the fishing community to become cancer champions. So what we will provide is their training to them. We'll provide them cancer awareness training. We're not expecting people to be clinical experts, but what we would like is for them to spread the message of your cancer symptoms, signs, what does treatment look like, what's your first appointment, what does this mean for you, what you're entitled to, if you have to take time off work, linking them into our Fishermen's Mission port staff who can support with social and welfare issues. What we were hoping is to give them that information, that training, the cancer champions, to spread the message of cancer awareness. Now, when I started, I thought, how can I ask a fisherman who works long hours, he could be out at sea for long days, long weeks, or months, to be a cancer champion? Now, being a cancer champion is if they can pledge 20 minutes of their time, if they could pledge an hour a week, if they can pledge 30 minutes a week to have a conversation, to give awareness, to spread the cancer information, knowledge to another person, that is a cancer champion. What we've found, we've got some former and retired fishermen who want to get more involved, and we're like, yes, definitely come more involved, where we'll be providing cancer awareness sessions. We'll be taking part in joint events with Cancer Community Services. We'll be taking part in campaigns. So if we have this fisherman there who are former fishermen who've got that time, come and get involved. This is their program, not ours. For active fishermen, we know that they're at work and work is their priority, but we want to get that message for them to be involved also. So providing cancer awareness training, we've even looked at how we deliver this training. So we'll deliver it around tide times. If a fisherman's really busy and it's, prawn season and they can't come and see us, we're going to put the training session on YouTube. So it's a 15-minute bite-sized training. So what we're doing is we're trying to fit this program, make it what's needed for this working population, because that's the only way it's going to work.
And where can fishermen and fisherwomen find out more about the Sea Aware program?
We'd like fishermen to come and see us. If we're on the fish quay, or when we're on the fish quay, come and have a conversation with us. Come and get to know the team. As we're based on the fish quay itself, we're in a 2-minute walk from the gut. Come and meet the team, get to know what we're about, come and ask questions, but actually have a conversation in an informed, relaxed environment. If a fisherman wants to have a conversation with us, we can do it on the fish quay, but we can do it in our office. We can do it wherever they feel comfortable. What we want to improve is having cancer conversations on the fish quay where men feel more comfortable talking about cancer screening, if they've got some symptoms, if they're going to the toilet a little bit more, if they found a lump in their testicle, they feel comfortable to have that conversation with us. We want to provide them cancer prevention information, how to be safe in the sun, how to look at your alcohol intake, maybe look at reducing the levels, looking at the dangers and risks of smoking, men, how to self-check. So we've got a lot of 3D models. If a man doesn't want to talk about it to us, we could lead the models around where they can feel for the lumps so they know how to do self-checks. We want to educate them to what the treatment options. Treatment is very different as it was in the 60s, 70s, or even the 80s. It is so different now. There's lots more to offer these men. That's what we'd like.
Yeah, it's one of those things that men are not very good at, is discussing touching any part of the body. Definitely. So it's a challenge to overcome that barrier.
What we found is that the barrier, even having the conversations, talking about cancer, the big C, and I've heard men say that, oh no, I can't be talking about that. And then I've had a conversation with a fisherman on the quayside around prostate screening. I never thought I would be having that conversation. But I was walking on the fish quay and a fisherman approached us, and it was a general conversation. How you doing? He was walking his dog, and he was saying, so what are you doing around cancer awareness? So we ended up talking about cancer screening, and he said, oh no, I couldn't do a prostate screening. I couldn't do that. I said, but what's that about? And he said, no, that's really uncomfortable. You know, you could see him cringing that this is not for me. So we had the 4 minutes. I had 4 minute conversation with him about how it can be uncomfortable and embarrassing for a couple of minutes with your GP to save your life. We had a really interesting debate on it, and he walked away with thinking, yeah, it is a couple of minutes with a GP feeling rather uncomfortable, out of my comfort zone, to find out if I've got cancer or not is worth it. And that's what we're doing. We're having these real honest conversations with the fishing community to say, why not? Why not put yourself first? Why not go for some screening? That could be a little bit uncomfortable. Why not take some time out of work and look after yourself? You know, why not look at your diet? And it's really hard. I do understand it's really hard for the fishermen when they're out at sea to, eat well because they're eating on the run. It's fuel. They've got to eat just to keep them going for long, long shifts. So we're looking at the why nots with them. I want to give
Yeah.
you can I give you a quote from a
Yeah.
fisherman?
Go ahead.
This fisherman was treated twice for bowel cancer. And these are his words. He says, I only wish that this program was around in the 1960s and 70s. He said that when I was working down here, a lot of fishermen would be walking around for a lot of years and they would not known about cancer or cancer screening. He said that a lot of fishermen would have had longer time with their family. They never got that, as there was nothing like this on the fish quay. And that sat with me and thinking, he's right. There's a lot of men that could have had a longer time and with their family if they had known.
Yes, and that's the sad fact of it, and what you call it. And that's why people should make the effort, no
Yeah,
matter what walk of life that you're in. People should make the effort to look after yourselves, because when you're gone, your family doesn't have that time with you, and it's something that time that we should all cherish. That when we
yeah,
have people around.
yeah. It's getting through these myths, getting through these stigmas that early screening cancer doesn't equal death, an automatic death sentence. That's what a fisherman said to me. It's a death sentence. Treatment is so advanced. There's more treatment options. But then on the flip side of that is like, what can we do to keep you physically well? Let's look at the risk factors.
Small steps can improve a lot of things for people.
And that's why we are there at their time around when it suits them. We will see them when it's needed. We'll be flexible. We have not created hoops for fishermen to jump through. They don't have to refer themselves to us or be referred to. They can come and see us as soon as they come off that boat, off that vessel, and they come and get that information and advice, and we can signpost them, direct them to the right services for them, and connect them to better healthcare.